On behalf of the Middle East African Uveitis Society, the Egyptian Ophthalmology Society, as well, the Egyptian uveitis study groups for the kind invitation, hospitalization, and this great enriched sessions that we have today. So I'm going to talk about ocular syphilis in the area of Middle East and North Africa. And with this, I would like to say this: I don't have any, financial interest in this. As you know, syphilis is a spirochetal bacterial sexually transmitted disease, and having three stages: primary, secondary, and tertiary syphilis with latent phase in between. Transplacental separate leads to congenital syphilis, and it can lead to vision loss if not treated, diagnosed and treated promptly on times. The incidence of syphilis has been increased over the past decades, especially in those affected with HIV, and it is considered re-emerging disease due to recent global increase in prevalence. Syphilis prevalence in the Middle East area and North Africa, thanks God, it is not that huge. It's reaching around 0.5%. And in Saudi Arabia, we have some survey like that, and we found that the average annual incidence of syphilis per 100,000 populations in 2006, 1.7 in Saudis, and non-Saudi increased to 6.4. And one in the last one on the 2016 found that it's almost the same or even though less. The high-risk populations, we found that the syphilis elevated rates observed among men who have sex with men, as well transgender individuals, female sex workers. So put this in your mind, these people, when you have something in your clinic, put your focus in history to make sure about these situations. What is ocular syphilis? It is not that an obvious disease. Usually 1 to 8% of the trichoma infections and ocular involvement occur at any stage, with highest likelihood during the secondary or latent stage of syphilis. The ocular manifestations ranging between interstitial keratitis, recurrent anterior uveitis, retinal vasculitis, optic neuropathy, and chorioretinopathy. It can be associated with neurosyphilis, and indeed, ocular syphilis is considered as neurosyphilis. If untreated, may lead to blindness, and diagnosis based on the clinical examination and serological test, and usually recommended to have two tests: fluorescein, trichoma, antibodies absorbent, and venereal disease research lab testing. And put in your mind that FTA ABS may lead to false negative, and usually VDRL used to look for the monitoring activity of the disease. The disease can be treated effectively with antibiotic, and while syphilis is globally prevalent, we think that ocular manifestations are less common and often. And put in your mind that it's most of these cases could be missed in diagnosis, and put as well in your mind that rate it is greater emanators, and usually it's resembling many ocular disease. I would like to share you one of our studies that's recently published, that is a retrospective multi-center study that analyzed 38 eyes of 19 patients diagnosed with ocular tuberculosis between 2021 and 2023. And what we noticed that there is an increased trends of ocular of syphilis and ocular syphilis in our community in Saudi Arabia. As you know that we are a closed community, but that's mean if you have it, you can that apply to other communities beside us. So what happened that we have around 90% of our patients were male. Average age is almost 41 years. The people that reported previous unprotected sexual encounter was around 53%, and 26% had HIV patients. So put that in your mind. These people usually they have unusual situations. And 68% of the patient shows systemic manifestation of syphilis. So usually when the patient comes to us, usually they have multi-system involvement. And this is as well the table that can show you most of the duration, usually within 30 days from the onset of ocular complaint. When we are looking for the clinical findings in this patient, we found that anterior chamber reaction was found in almost in 73% of the patients. Vitritis is 48.5, hyperemic optic disc 62%, vascular sheathing 47%, placoid lesion is 51%, which is important because this is the most one that we can diagnose. And most common ocular phenotypes, acute syphilitic posterior placoid, choroidititis, and I will show you some cases, and necrotizing retinochoroiditis in almost 50% of the patient. And 3 patients were misdiagnosed upon the examination of this patient. One of them is acute retinal necrosis, and I will show you the case, and 2 patients as Bahjat disease. And you know that treatment is almost opposite to what we do in the syphilis. What are the multimodal imaging behavior? We found that autofluorescence showed that more placoid lesion when you compare it with the direct examination clinically, and OCT showed that ellipsoid zone loss and disruption in 23 eyes, almost in 80% of the patient, with hyperreflectivity, nodular retinal pigments in 79% of the patient. Fluorescein angiography had an optic nerve hyperfluorescence in 93% of the patient, with vascular leakage in 83%, and 62% showed that staining of the site of the placoid lesions. I will show you this is a case of bilateral involvement of young patient, 25 years old, and if you look for the placoid lesions on both eyes, on the posterior poles, and you're looking for fluorescein angiography, autofluorescent, to find that the hyper-autofluorescent area that correlated with the clinical placoid lesions. OCT showed that hyper-reflective nodularity at the level of ellipsoid zone with loss of ellipsoid zone, and this is one of the pathology that we look for it carefully in our patient with syphilis. Fluorescein angiography showed that the staining, hypo, and then staining of the lesion itself. Another patient which showed that placoid lesions involving the posterior poles and the inferior showed that optic nerve staining, and as well, vasculitis. And when you are looking for the area that correlated with the lesions, you saw that there is an pigmentary changes with hyper-autofluorescence in the area. As well in the OCT, you can see the majority of the ellipsoid zone and retinal epithelium. This is one more patient that presented with vasculitis, so not unusual to have a patient with syphilis and vasculitis and cystoid macroedema. This is a case that I show you that having special types of lesions, almost everything is here, is going that with the, and this is where we have to show unusual presentation of globular peripheral lesions with many retinal precipitate at the center of that lesions. And this is actually anterior, not posterior. So this is one of peculiar. When you're looking for fluorescein angiography, the autofluorescence is not showing a lot of autofluorescence related to that lesions. The patient having papillomacular rashes in her hands, and be careful, this might be at the stage of drying, it might be infectious. This is the lesions without any treatment 2 weeks later that increase in size. So we put the differential diagnosis, possibility of hemangioma, solitary choroidal granuloma, posterior scleritis, and could be metastatic lymphoma and syphilis, because it's the first case that we saw at 2021. So the fluorescein angiography showed, as usual, of any inflammation, hypofluorescent that later having some staining of the lesions. The patient is diabetic in the same times. When looking for fluorescein angiography, there is disorganizations and stratifications of the retinal layers with nodularity of the ellipsoid zone and retinal pigmented epithelium, with many vitreous cells in this patient, as well the patient diabetic and having macroedema. B scan showed no significant finding. So this is what we did, and we found that the patient is having positive VDRL and serology for that. So we diagnosed the patient as acute syphilitic posterior placoid choroidititis, and we start the treatment and see after just only 10 days with intravascular penicillin that the lesions were resolved, and even though offer the OCT and the macula. So A diagnostic approach usually based on the clinical as we mentioned, and as well the finding that need our multimodal imaging, including fundus photos, autofluorescent, fluorescent angiography, optical coherence tomography, and the clinical evaluations. Interference penicillin is the mainstay of the treatment, and there is alternative. Sometimes we have to use it in this patient. I think what we need to, this is a treatable conditions with antibiotic, and we need to communicate with our infectious disease that helping the patient, especially if the patient having HIV on top of the syphilis. And awareness and education of our communities, and making, that promoting safe sexual practice with rigorous screening for patient at risk. So in conclusions, ocular syphilis is re-emerging disease in the MENA area. Early diagnosis and appropriate treatment are crucial to prevent visual loss. Collaboration between ophthalmologists and infectious disease specialists is essential for effective management, and encourage routine syphilis screening in patients presenting with uveitis. And lastly, enhance national sexual transmitted disease surveillance systems. Thank you very much for your attention.